Hello, everyone. Good afternoon. My name is Terri Al-Hadi. I'm a social worker at the Children's Hospital of Philadelphia here in PA. I'm not sure where everyone is from, um, but today I'll be talking to you guys about insurance, Medicaid, and SSI for children and young adults. I'll go to the next screen. This is good. Okay. So just a little bit about what we're talking about today, insurance state versus commercial. And I'll give some explanations about what that is. Some of you may know and some of us may not. So we'll just do a little bit of a preview. Most state insurance generally is anything that's like government funded. So those are our Medicaids and Medicares, sometimes even the federal marketplace. If you're a person or individual who doesn't qualify for Medicaid, the state system may push your application over to the federal marketplace side, which was brought about during the Affordable Care Act era a few years ago. Um, they also have our CHIP programs. Children insurance plans are generally state and government funded. MAUD is an insurance for medical assistance for workers with disabilities. And we'll go a little more in detail about MAUD for people over the age of 16 are eligible for Medicaid if they're working. And the income guidelines are a little bit higher for MAUD than it is for straight medical assistance. So it gives another option for young adults or children who are working and may have some type of a disability who would not otherwise be eligible for Medicaid. Also with state government insurances, you can have pharmacy benefits and benefits for durable medical equipment. Sometimes people get a little confused about the difference in getting things from a pharmacy side of a benefit and going through a durable medical equipment side. Sometimes a lot of your prescriptions for your medicines could be covered under your pharmacy benefits, but sometimes you need equipments that you don't go to the pharmacy for. You have to get them through durable medical equipment or suppliers. And often people try to get things covered through their prescription side and are denied. And just through a little education, need to let their physician or whoever wrote that script out that this needs to go through like a durable medical equipment supplier rather than a pharmacy so that it can be covered. So also state insurances primarily don't have premiums. So you're not paying out of pocket monthly for this benefit. Although there are, like for instance, CHIP, sometimes it is based on what we would say maybe it's income based. So there are often times when you are not paying anything out of pocket, but I do know that there are some individuals, some households who do need to pay a small premium in order to have CHIP benefits for their child or their family. The commercial side, most commercial insurances are insurances that are coming through our employer. So they're employer-employee funded. So if you are working a job, you have open enrollment, then you're signing up for the benefits that your employer supplies to the employees. These are definitely insurances that we have premiums for that we're probably paying biweekly or monthly for out of our paycheck. There's COBRA. Sometimes COBRA is when you're no longer working for this employer, but you have a period of time where you are eligible to still receive some of the medical benefits, but you have to pay a higher premium for them, unlike what you would be paying if you were still working for that employer. And then the federal marketplace. So the federal marketplace, they have premiums. So you will be paying out of pocket sometimes. And that's on a sliding scale again. So it would be income based. Some people are not paying, not everyone in the federal marketplace who picks an insurance plan is paying the same premium or the same amount, the same monthly fee. So with our employee-based insurances, we have like our HMOs, our PPOs, and our point of services. On the Medicaid side, sometimes you have just straight Medicaid. So in Pennsylvania, it's called, we call it PAMA or PAMA, Pennsylvania Medicaid. You can have straight Pennsylvania Medicaid, but more often than not, when you are deemed eligible, then you have to choose an HMO, a health management option for your insurance, for ongoing insurance. Also on the commercial side, they include the co-insurances, the deductibles, and things of that nature. On the state side, you don't have the co-pays, the co-insurances, and the deductibles. And then you also have your pharmacy, your durable medical equipment on the commercial side as well. Some of the things I just mentioned, just to go over some definitions. So your premium is your payment to your insurance monthly out of pocket or your paycheck. Your deductible is the amount you pay out of pocket before your insurance will cover the cost. A lot of times people have, you may hear people saying it's a high deductible. And when you're choosing insurance through your employer, you're basically basing what works well for your family. So sometimes people choose to have, I don't have a child who maybe have some medical diagnosis that requires them to be seen quite often or by different specialists, or visits every month or every 2 weeks. So they may choose an insurance that doesn't require a lot on the back end, because they feel like they are, not going to be using it. They may just be having regular well visits or things like that. And you have and generally out of pocket monthly, that may be a cheaper option for you. But if you have a high deductible, and then you have a high deductible, some families choose to not have a higher deductible. They want a lower deductible, because they know that what they'll be having to pay on the back end is that much greater. Co-insurance is a percentage of what you are going to pay out of pocket. So, you may have to go to a doctor visit and your insurance is saying, we'll pay 90% of this visit and you'll pay 10%. Or if your child is admitted to the hospital, we're paying 80% of the hospital stay and you're paying 20% of the hospital stay. And then your co-pay is, you're going to a well visit, your insurance is paying for this visit, but every time you go to see your doctor, your regular primary care doctor or pediatrician, you're paying $10 of a copay. If you're going to a specialist, you're paying $50 of a copay. If you're going to the ER, you're paying $100. That makes sense. So at least in PA, and this probably applies to many states, and PA is one of the only states that has where children under the age of 18, if they have a chronic medical condition, they're automatically entitled to having Medicaid as a secondary insurance. There are not many states that have theirs. There's one other state, and I can't think of what it is at this time. And I know we're in our tri-state, which is Delaware, New Jersey, and Pennsylvania. I know Delaware does not, but I have worked with families in New Jersey who have applied as a secondary and received some type of service. It may have been just prescription benefits being covered. It may have been for long-term nursing services to be covered. And what I generally tell the families that I work with who live in New Jersey is, instead of applying online, go into the office, speak to one of the caseworkers and explain your scenario. Because sometimes those caseworkers, when they are determining eligibility, and I know this is a computer system, but they know what you may be eligible for based on what you're saying. And sometimes when we're applying online, computers just don't get it in that way. Um, and we have had a few families that have had some success by just going to their county assistance office to apply rather than doing it online. So in Pennsylvania, your child may already be covered by um, your commercial insurance through your employer, and they have now a chronic medical condition. They're under the age of 18. You can apply for Medicaid as a secondary for them. So they are entitled to it, but you still need to apply. It's not automatic. And one of the things that you need to do is the first thing you need to call Social Security and do a telephone screening to see if your child is eligible for SSI. So because Medicaid feels like if they're eligible for SSI, which is on a federal level, then they'll also receive insurance through Medicaid, and which is great because if you call and you're eligible for SSI, and you receive it, great, right? No other steps needed. If your child is denied SSI due to your income, not due to their diagnosis, but due to their income, then they can be eligible for this secondary Medicaid. And that would cover, when you have those deductibles as it relates to this particular individual in your household, this child, it will cover those deductibles, that co-insurance and those co-pays. The federal government says that someone who's eligible for Medicaid should not be receiving bills for services. They shouldn't be getting billed for services. The caveat to that is that you need to be going to providers that accept Medicaid. So if, for instance, one of the things I explain to my families is your child is now eligible for this Pennsylvania Medicaid. Here's how you apply. Once they apply, they're approved for the state Medicaid, open Pennsylvania Medicaid, and then they need to choose an HMO for long term. You want to check with one, your primary care provider. Who's their pediatrician? Do they accept Medicaid? And if they do, which Medicaids do they accept? Do they accept the Aetna or do they accept the Keystone? You want to kind of like check in with them to see what they accept. Because if you've been with a pediatrician for 10 years and now they're not accepting the Medicaid, it's a little bit of a, thing there because you're trying to think, okay, so I do need this secondary insurance to help me support my child's medical needs, but now my pediatrician doesn't accept this Medicaid. So what do I need to do? Am I changing pediatricians? Am I, just going to not worry about having the Medicaid? That's a decision that some of our families have to make. Most times the pediatricians that our families have accept the Medicaids. Then it comes down to which one. We accept Medicaid, but we only accept Keystone, East for Keystone first, or we accept Medicaid, but we only accept Aetna Better Health. So that's a conversation that you want to have with them. So you call SSI, you get denied. You go onto the conference website and you apply for your state Medicaid insurance. In Pennsylvania, they have to determine your eligibility and send you that eligibility notice within 30 days. Every state is different. I've seen some states be 45 days. I've seen some states be 90 days. Every state is different. And you can probably go on your state's website and find out what the time frame is for determining eligibility. You can also go on your state's website and find out what the income guidelines are. For this secondary medical assistance through Pennsylvania, regardless of a parent's or household income, the child is still eligible. So it doesn't matter, what the parent's income is. This child is still entitled to this Medicaid as a secondary insurance. When you are completing these applications, You're listing your household members on the application, and next to each person's name, they will say, are you applying for this person? That's going to be a no for everyone in your household except for your child who has some kind of serious illness, chronic illness, disability. That's who you want to say yes to. That in turn lets that system know that, okay, we're looking at this particular individual. Also on that application, it will say, does this person have a chronic illness, serious illness, disability? So you want to say yes to that if that applies to your child. That lets the system know, okay, we have this one individual under the age of 18, they have this chronic medical condition. If the income guidelines say that they're not eligible, the system automatically reworks itself to say they're still eligible and entitled. Once you receive the notice of the eligibility, they'll ask you to pick your HMO, like I said earlier, and then that's when you want to, select whichever one you think will work best for your family. You can apply for these Medicaids online through your government website. You can go to your local county assistance offices and apply in person. In Pennsylvania, you can apply over the phone, or you can get an application and you can mail it in with all of your documents. Most times, the most important things to remember when you're applying for these insurances is providing residency. You have to prove that you live in the state that you live in. You have to prove your identity. So you have to have some identification, some state identification. You may have to supply birth certificates, social security cards. So try to gather that information and have ready. I never suggest that we send originals to any of these county assistance offices. You can always send copies of what you have to these offices. They do not, most county assistance offices will not return your documents. And it can be a bit of a hassle trying to, recreate those things. So always make copies to submit. And like I said, in Pennsylvania, the deadline is 30 days for them to notify you. Each state is different though, but you should be able to find that information on your state's website. A lot of the Medicaid providers have special needs units. And I often suggest a lot of our families, when you become a Medicaid recipient, or when your child becomes eligible for Medicaid and you become a Medicaid recipient, is try to get them a case manager. And case managers help in a lot of times when we are trying to get things like private duty nursing to come to the home. Case managers can help in those areas, or private duty nursing to come to the school, a care assistant. The case managers can kind of like help you navigate all of your insurance. When we were talking about DMEs and pharmacy benefits, case managers can kind of help you with that. These numbers up here, these are special units for, in Pennsylvania or in Philadelphia County, we have Aetna Better Health, we have Coventry Cares, Health Partners, Keystone Mercy Health Plan, and United Healthcare Community Plan. They have 24-hour hotlines where you can call and get some of your questions answered about your particular insurance, what may be what your child may be eligible for, what your plan will cover, things about your pharmacy benefits. Should I be going through mail order for benefits? Should I have things sent to the house, or should I on a 3-month supply, or should I be going to the pharmacy to pick things up? Am I eligible for a private duty nurse? Do I have a day hospital benefit? Do I have long-term nursing care benefit? Questions that you may have about your Medicaid as it relates to your child and their illness can probably be answered from a special needs unit or through having a case manager. And a lot of the Medicaids have case managers. So it's just calling the member's benefit on the back of your card and inquiring about that. I will say that there is a lot of, even in applying for the Medicaids, I know it's a tedious process. There is so much paperwork involved. Um, there are, an hour or so on the computer, sometimes, 15 or 20 minutes on hold. But I think the benefit far outweighs the time that we have to spend and put into it, because the benefits that our children receive from having this can be great, especially if we're worried about financially coming out of pocket for a lot of medication, supplies, office visits, and things like that. SSA, SSI, SSDI. So we'll talk about Social Security and what this means for us. And of course, we will answer questions at the end of this presentation if anyone has questions. So SSA is just Social Security Administration, right? That's the building. This is who is processing these applications for us. And I think there's sometimes a lot of confusion about SSI and SSDI. So SSDI is Social Security Disability Insurance. That's basically what we have paid into over time from working that we may be eligible for if we become disabled. SSI is Social Security income. This is probably what we're going to be speaking about in the next 2 slides. This is what we'll be speaking about in the next 2 slides. So Social Security income is the cash benefit that is allowed for being when we are disabled. And this is what we'll be applying for if we have a child or individual who is deemed disabled by Social Security. Okay, so SSI, just like Medicaid, is income-based. It is, and when you have a child that's under the age of 18, the household, where they live and their parents' income is what is being considered. Just like Medicaid, that particular household where their child lives, that's the income that's being considered. You must meet, or your child must meet for eligibility. Your child must meet the eligibility guidelines deemed by Social Security as far as diagnosis. And in our next slide, we can go to a list of what some of those diagnoses are. And you must meet the income and resource guidelines. And Social Security can tell you what they are. They are, I couldn't say, for this particular household, this is what it is. Social Security answers those questions. We'll talk about the application process and medical records, which is probably the most important part of applying for SSI for your child. More than half applications get denied the first time around. And I don't think it's a particular formula for that. If I had my druthers, if a child is disabled, they should be eligible and be receiving these benefits. I think that the fact that we take individuals through so much to prove a disability is something quite not, doesn't sit right with me about that. But one of the things that's very important is to have appropriate medical records. And the onus should not be on the parent to gather all of these documents from all of the different specialists that your child may have. Social Security should be, you'll give Social Security your child specialist and they'll be reaching out to get those documents. What is really important is for those medical records, for your child specialist or primary care doctor, for them to be documenting over time what the disability is and what the impairments are for their daily living and how it has been affecting their life. You know, if you have a child that's, you're going to the doctor and they're like, oh, they're doing well. I mean, they're not really putting in how things are impeding their lives. Then when you are applying, and these other doctors that are reviewing these applications, they don't see how this is affecting their life, right? They're not seeing that they may not be able to work. They're not seeing those things. So it's really important to have the medical records really explaining what the diagnosis is, what kind of risk are involved with this diagnosis, um, what kind of treatment is involved with this diagnosis, and how it is affecting their daily life. The other thing is if your child has an IEP plan, that can be also a part of the record, because how is it affecting school? How is, it affecting learning? Has it been affecting development? All of those things are so important. So we want to make sure that they are properly documenting. And we want to make sure that when we are submitting our application, um, all of that information is received so that they have a fair chance of receiving what they need. Some of these links, I thought that I would be able, I probably can. So the number for Social Security I have here is 1-800-772-1213. And you can call Social Security. I would say sometimes when you call, give yourself some time. So note it when you call. Don't call if you only have like 5 or 10 minutes to spare, because sometimes you could be on hold for 5 or 10 minutes. So, pick a day that you say, I'm going to sit down and at least get on the phone with Social Security and get some questions answered. And there are people there who will answer your questions. Um, I know I help families when they're applying for secondary medical assistance. Um, we want to call, set up a telephone screening to see if your child is eligible for SSI. Let's start there. Um, they may give you a date. They'll give you a date and a time for a telephone screening appointment. That might be within a week. It could be within a month, depending on, how many um, applicants they've had during that time frame of calling. But I would start there. I would call, get on the phone, and see if you can get a telephone screening. Sometimes during that telephone screening, they can say, no, you're going to be denied due to income, right? And which, for my families at least, is fine, because they're trying to really apply for secondary medical assistance. So being denied for Social Security due to income is fine, because they're not really applying for Social Security. It's just a step that they need to go through in order to get this secondary Medicaid. Um, but then they may say, okay, we need more information. They may be eligible. We're going to send you out a packet or something like that. And then that's when your application process kind of sort of gets on a roll. Earlier, when I was saying sometimes parents have questions like, if I work, is my child still eligible? That depends on income and resources. Your child may still be eligible even though you work. They may still be eligible for SSI. Even children who are able to work, could still be eligible for SSI. Children who are in school, who are in school, and they have certain guidelines about what school is. It doesn't necessarily have to be four-year university. It could be a trade school or a certain amount of hours. They could still be eligible to receive SSI and still work and have income. A lot of those questions could be answered at this link here, the ssa.gov pubs. I think this slide is going to be saved for you guys, so you can always go back to it and play around with some of these websites and get your questions answered. And when we were talking earlier about the diagnoses that SSI deems as being disabled, this link here will tell you what those diagnoses are. And as far as the Medicaid, this is primarily Pennsylvania information, but here are a few links where you can get more information about Pennsylvania Medicaid. PH95 is that category that I was speaking of about the secondary medical assistance. Some people call it a loophole in PA because not, like I said, not many states have it as a secondary, but here are some of the links. And if you are a patient or if you're a family who has a patient, a family of CHOP, I just listed their link for what insurances are accepted at CHOP, the billing office, and information like that.
Terri, you ready for questions?
Yes.